Lecture number 8. The topic is affective disorders. Actuality of the topic. Affective disorders, known since a lot of years ago in form of mania and depression. Depression is a common illness worldwide with an estimated 3.8% of the population affected, including 5.0% among adults and 5.7% among adults older than 60 years old. Approximately 280 million people in the world have depression. The word affect is a synonym for emotion and mood. Affective disorders are a set of psychiatric disorders, also called mood disorders. The main types of affective disorders are depression and bipolar disorder. Symptoms vary by individual and can range from mild to severe. Depression. Depressed mood is a component of many psychiatric syndromes and occurs with physical illness. Depression or major depressive disorder is characterized by feelings of extreme sadness and hopelessness. It's more than simply feeling down for a day or two. If you have depression, you may experience episodes that last for several days or even weeks. A milder form of depression is called dysthymia. Especially when recurrent and with moderate or severe intensity, depression may become a serious health condition. It can cause the affected person to suffer greatly and function poorly at work, at school, and in the family. At its worst, depression can lead to suicide. About 1 million people die due to suicide every year. Suicide is the first leading cause of death in young people, 15 to 29 years old. Depression is characterized by at least 2 weeks of low mood that is present across most situations. The most common types of depression include: Number 1. Major depressive disorder, MDD, previously called clinical depression. MDD includes long-term and persistent episodes of low mood, hopelessness, fatigue, and other symptoms. Number 2. Persistent depressive disorder, also called dysthymia. This type of depression is characterized by less severe depression symptoms occurring for at least 2 years. And number 3, major depressive disorder with seasonal patterns, commonly known as seasonal affective disorder. This subtype of depression most often occurs during the winter months when there is less daylight. There are also certain types of depression experienced by females due to hormonal changes at various life stages. Examples include prenatal depression during pregnancy and postpartum depression after birth. Some women also experience depression alongside other symptoms of premenstrual dysphoric disorder. It's possible for men to experience postpartum depression as well, so this is not associated with hormonal changes like in women. Depression causes. Number 1. Genetics. Family history. You are at a high risk for developing depression if you have a family history of depression or another mood disorder. Depression can run in families. Having a close relative with the condition can raise a person's risk for developing it themselves. Number 2. Brain structure. There is a greatest risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Cause number 3. Biological and chemical differences. Physical changes or chemical imbalances in the brain may contribute to the development of depression. Number 4. Early childhood trauma. Some events impact the way that body reacts to fear and stressful situations. Next cause is hormones. Hormonal changes or imbalances in the body may cause or trigger depression. For example, many women experience postpartum depression after giving birth. Medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, attention deficit hyperactivity disorder. Next cause is drug use. A history of drug or alcohol misuse can impact your risk. About 30% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical, personal history of mental illness, stressful events such as loss of loved one, economic problems, or divorce, and certain medications. Various psychotropic drugs have a depressogenic effect. For example, antipsychotics, which are used to treat various psychoses, like Risperdal, Clopixol, haloperidol, and others. Side effects are also possible from tranquilizers and even antidepressants in case of overdose. Such symptoms can occur not only against the background of taking psychotropic drugs, but also general medicine. For example, beta blockers, hormonal drugs, interferons, and drugs to reduce stomach acidity. And please look at this picture. Depression causes: genetics, brain chemistry imbalance, poor nutrition, physical health issue, drugs, stress. Depression symptoms can vary from mild to severe. Feeling sad or having a depressed mood. Loss of interest or pleasure in activities once enjoyed. Changes in appetite, like weight loss or gain, and trouble sleeping or sleeping too much. Loss of energy or increased fatigue. Increase in purposeless physical activity or slowed movements and speech. Feeling worthless or guilty. Difficulty thinking, concentrating, or making decisions. Thoughts of death or suicide. And please look at this picture: signs and symptoms of depression. Persistent feeling of sadness, loss of interest in activities, trouble sleeping or oversleeping, appetite or weight changes, fatigue or decreased energy, difficulty thinking clearly and quickly, irritability, frustration or pessimism, physical aches and pains, and last, recurrent thoughts of death or suicide. In classic depressive disorders, the central features form depressive triad, which consists of low mood, psychomotor retardation or lack of interest and energy, and poverty of thought. The low mood includes misery, anxiety, irritability, agitation, lack of enjoyment. Psychomotor retardation is manifested in slowness of movements, reduced energy and motivation. Gesture movements are reduced. Poverty of thought means decreased speed of thinking. In addition, the patients develop pessimistic thinking. Beck's cognitive triad, also known as the negative triad, and consists of the negative views about the world, negative views about the future, and negative views about oneself. Beck's cognitive triad, are also known as the negative triad, is a cognitive therapeutic view of the three key elements of a person's belief system present in depression. The triad involves automatic, spontaneous and uncontrollable negative thoughts about the self, the world, and the future. Examples of this negative thinking. About the self: I am worthless and ugly. I wish I was different. About the world: no one values me, people ignore me. And about the future: I am hopeless because things will never change, things can only get worse. This triad was proposed by Aaron Beck in 1976. Aaron Temkin Beck was an American psychiatrist. He is the father of both cognitive therapy and cognitive behavioral therapy. His pioneering theories are widely used in the treatment of clinical depression and various anxiety disorders. Depression can affect men, women, and children differently. Let's talk about symptoms of depression in men. Mood: anger, aggressiveness, irritability, anxiousness, restlessness. Emotional sphere: feeling empty, sad, hopeless. Behavioral changes: loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, engaging in high-risk activities. Sexual sphere: reduced sexual desire, lack of sexual performance. Cognitive sphere: inability to concentrate, difficulty completing tasks, delayed responses during conversations. Sleep: insomnia, restless sleep, excessive sleepiness, not sleeping through the night. Physical sphere: fatigue, pains, headache, digestive problems. Symptoms of depression in women: mood, irritability. Emotional sphere: feeling sad or empty, anxious or hopeless. Behavioral changes: loss of interest in activities, withdrawing from social engagements, thoughts of suicide. Cognitive sphere: thinking or talking more slowly. Sleep: difficulty sleeping through the night, waking early, sleeping too much. Physical sphere: decreased energy, greater fatigue, changes in appetite, weight changes, aches, pain, headaches, increased cramps. Symptoms of depression in children may include mood, irritability, anger, mood swings, crying. Emotional sphere: feelings of incompetence or despair, crying, intense sadness. Behavioral changes: getting into trouble at school or refusing to go to school, avoiding friends or siblings, thoughts of death or suicide. Cognitive sphere: difficulty concentrating, decline in school performance, changes in grades. Sleep: difficulty sleeping or sleeping too much. And physical sphere: loss of energy, digestive problems, changes in appetite, weight loss or gain. Protopopov triad. Viktor Protopopov described the triad of somatic symptoms. This triad includes mydriasis, dilation of pupils, increased heart rate, tachycardia, and constipation. Viktor Protopopov is an Ukrainian psychiatrist, teacher, founder of the Ukrainian School of Psychiatry. And look at this picture: effects on the body: depression, insomnia, headaches, fatigue, chronic pain, diarrhea, constipation, inflammation, loss of libido, weight loss or gain, nausea, increased risk of heart diseases. Sleep disturbances. In depressive disorder, sleep disturbance can be of various types. Most typically is early morning waking, but delay in falling asleep and waking during the night also occur. Early morning waking means 2 or 3 hours before the patient's usual time. He does not fall asleep again. He or she thinks about the coming day with pessimism, broods about past failures, and ponders gloomily about the future. This combination of early waking with depressive thinking is important in diagnosis. Pessimistic thoughts. Pessimistic thoughts or depressive cognitions are important symptoms which can be divided into 3 groups. The first group is concerned with the present. The patient sees the unhappy side of every event. He thinks that he is failing in everything he does and that other people see him as a failure. The second group of thoughts is concerned with the future. The patient expects the worst. He faces failure in his work, his finances, his family, and his health. These ideas of hopelessness are often accompanied by the thought that life is no longer within living and that death would come as a welcome release. And the third group of thoughts is about the past events. Appearance signs: poor hygiene and personal grooming, slouched posture, staring at the ground, wearing the same clothes several days in a row or never changed out of pajamas, and louder shoulders. Face: sad face expression, a fold around the outer third of the eyebrow, fold of Veragut, and louder corners of the mouth. Major depressive disorder. Definition: mood disorder that presents with at least a 2 week course of symptoms that is a change from the patient's previous level of functioning. Must have depressed mood or anhedonia, inability to enjoy oneself. Symptoms: depressed mood most of the day, anhedonia during most of the day, significant weight loss, more than 5% of body weight, insomnia, psychomotor agitation or retardation, fatigue or loss of energy nearly every day, feelings of worthlessness or guilt, diminished ability to concentrate, and recurrent thoughts about death. Physical examination. Usually within normal limits, however, may find evidence of psychomotor retardation such as stooped posture, slowing of movements, slurred speech. May also find evidence of cognitive impairment such as decreased concentration and forgetfulness. Major depressive disorder may also include psychotic features, in this case, worse prognosis, and atypical features like increased weight, increased appetite, and sleep. Treatment must first secure by the safety of the patient, given the suicide in such a high risk. Pharmacotherapy includes antidepressant medications such as SSRIs, tricyclic antidepressants, or monoamine oxide inhibitors, MAOIs. Next type of therapy is electroconvulsive therapy. May be indicated in patient is suicidal or intolerance to medications. And individual psychotherapy is indicated to help the patient deal with conflicts, sense of loss. Another form of therapy is cognitive therapy, which will change the patient's destroyed thoughts about the self, future, and world. Example of major depressive disorder. A 70-year-old woman was recently admitted after her son informed the doctor that she had been doing very poorly over the past few months. The patient reports are 30-pound weight loss, decreased concentration, feelings of helplessness and hopelessness, decreased energy, depressed mood, and decreased sleep. Bipolar disorder. Definition. These mood changes may include episodes of depression along with periods of mania or hypomania. Risk factors. Bipolar disorder affects men and women equally and has a mean age of onset of about 18 years. Coexisting disorders may include anxiety, alcohol dependence, and substance-related disorders. And bipolar disorder is the illness with the greatest genetic linkage. There are different types of bipolar disorder. Bipolar 1 is defined by episodes of mania that last for at least 7 days. You may also experience depressive episodes that last for 2 weeks or more, though depression may not occur in bipolar 1. And next type is bipolar 2. This type includes episodes of depression lasting at least 2 weeks along with mild mania called hypomania. Symptoms of bipolar disorder. During depression, symptoms similar to those for major depressive disorder. During mania, symptoms abnormal or persistently elevated mood lasting at least 1 week. Increased self-esteem, distractibility, excessive involvement in activities, more talkative than usual, psychomotor agitation, and flight of ideas. Increased sexual activity, increased in goal-directed activity, less sleep or feeling of exaggerated self-confidence, irritability, aggression, self-importance, impulsiveness, increased appetite, recklessness, or in severe cases, delusions or hallucinations. Clinical features of mania. manic triad. Elated mood means euphoria, sometimes mixed with irritability, overactivity, and flight of ideas, flight of thought. A systemic scheme for the description of affective disorders episode. Number 1. Severity can be mild, moderate, or severe. Type: depressive, manic, mixed. Special features: with neurotic symptoms, with psychotic symptoms, with agitation, with retardation or stupor. Course: unipolar or bipolar. And etiology: like reactive or like endogenous disorder. Masked depression. The term masked depression is sometimes used when there are depressive features but depressive mood is absent. Masked depression is a form of atypical depression in which somatic symptoms or behavioral disturbances dominate in the clinical picture. Some people with depression may try to hide the signs from others, or they may not even realize that they have depression. Although the typical symptoms of depression, such as sadness or hopelessness, can be easy to recognize, there are symptoms that may be less obvious. Appetite and weight changes. Eating too much or too little can suggest the presence of depression. Some people turn to food for comfort, while others lose their appetite or eat less due to low mood. These changes in food intake can cause a person to start gaining or losing weight. Changes in sleep habits. There is a strong link between mood and sleep. A lack of sleep can contribute to depression, and depression can make it more difficult to sleep. Research suggests that chronic sleep deprivation can lead to depression. This may be due to neurochemical changes in the brain. Alcohol or drug use. Some people with mood disorders may use alcohol or drugs to cope with their feelings of sadness, loneliness, and hopelessness. The Anxiety and Depression Association of America report that in the United States, around 1 in 5 people with anxiety or mood disorder, such as depression, also have an alcohol or substance use disorder. Fatigue. Feeling excessively tired is a very common symptom of depression. Some research suggests that over 90% of people with depression experience fatigue. Also, everyone feels tired from time to time. People who have severe or persistent tiredness, especially if it accompanies other symptoms, may have hidden or masked depression. But some depression goes unrecognized. Why? Because the symptoms are atypical. How can depression sometimes be masked? Type number 1, hidden. Example: I am so busy with work and have no time for social activity. Next type, faked. I am feeling fine, just a bit stressed. Next type, displaced by Angie. There is nothing wrong with me, just get off my back and leave me alone. Next type, masked by addiction, drugs, alcohol, food or sex. I just need a drink to help me relax. No big deal. When depression is masked, it's difficult for others to recognize what's going on beneath the surface. Treatment of depressive disorder. Number 1, standard antidepressant drugs. Number 2, newer antidepressant drugs. Number 3, electroconvulsive therapy. Number 4, lithium. What medications help treat depression? Depression affects the brain, so drugs that work in the brain may prove beneficial. Common antidepressants may help ease symptoms. Each drug used to treat depression works by balancing certain chemicals in our brain called neurotransmitters. These drugs work in slightly different ways to ease depression symptoms. Antidepressant medications, clinical guidelines. Overall efficacy for treatment of major depressive disorder is around 70%. Newer antidepressants should be considered first because of better safety profile. Difficult to predict which patient will respond to which antidepressant, so trials of several antidepressants may be necessary before an effective one is found. If no response to treatment after 4 weeks, or if patient cannot tolerate current antidepressant, switch to another. Treatment should continue for 6 months or 1 year after good response. Classification of antidepressants. Selective serotonin reuptake inhibitors, SSRIs. Serotonin and norepinephrine reuptake inhibitors, SNRIs. Tricyclic antidepressants, TCAs. Tetracyclic antidepressants. Dopamine reuptake blocker. 5-HT1A receptor antagonist. 5-HT2 receptor antagonists. 5-HT3 receptor antagonists. Monoamine oxidase inhibitors, MAOI, and noradrenergic antagonist. Antidepressant antibody effects. Sedation due to histamine blockade, hypertension, anticholinergic effects, cardiac, seizures, and sexual dysfunction. Selective serotonin reuptake inhibitors, SSRIs. SSRIs are the most commonly prescribed class of antidepressants. An imbalance of serotonin may play a role in depression. These drugs fight depression symptoms by decreasing serotonin reuptake in the brain. SSRIs include sertraline, citalopram, paroxetine, and others. SSRIs inhibit reuptake of serotonin. Reduced number of serious side effects, simple dosing schedules, significant incidence of agitation, nausea, vomiting, headache, diarrhea, and sexual dysfunction. Serotonin and norepinephrine reuptake inhibitors, SNRIs. SNRIs helps improve serotonin and norepinephrine levels in your brain. This may reduce depression symptoms. These drugs include duloxetine, venlafaxine, and others. Tricyclic antidepressants, TCAs. They are often prescribed when SSRIs or other antidepressants don't work. TCA include amitriptyline, doxepin, and others. TCAs have adverse effects: significant sedation, orthostatic hypotension, and anticholinergic effects. They are the most dangerous antidepressants in overdose. Common side effects of TCA can include constipation, dry mouth, fatigue. The most serious side effects of these drugs include low blood pressure, irregular heart rate, and seizures. Tetracyclic antidepressants have common side effects: drowsiness, weakness, lightheadedness, headache, blurry vision, dry mouth. Dopamine reuptake blocker. Bupropion is a mild dopamine and norepinephrine reuptake blocker. It's used for depression and seasonal affective disorder. It's also used in smoking cessation. Common side effects include nausea, vomiting, constipation, dizziness, blurry vision. Monoamine oxidase inhibitors, MAOIs, are all the drugs that treat depression. They work by stopping the breakdown of norepinephrine, dopamine, and serotonin. They are more difficult for people to take than most other antidepressants because they interact with prescription drugs, non-prescription drugs, and some foods. They also cannot be combined with stimulants or other antidepressants. MAOIs include, selengline and other medications. MAOIs. Indications: second-line treatment for major depressive disorder, depressive disorders with atypical features, and some anxiety disorders. Hypertensive crisis may occur with theramine-rich foods or if certain other medications are ingested, including antihistaminic medications and amphetamines. Avoid red wine, aged cheese, and chocolate. Adverse effects: sedation, weight gain, orthostatic hypotension, liver toxicity, and sexual dysfunction. Noradrenergic antagonist, mirtazapine, is used primarily for depression. It alters certain chemicals in your brain to ease depression symptoms. Common side effects include drowsiness, dizziness, weight gain. Treatment for mania. Number 1. Antipsychotic drugs. Number 2. Lithium carbonate. Number 3. Electroconvulsive therapy, when antipsychotic drugs are ineffective. Antipsychotic medication. Antipsychotic medication are used as a short-term treatment for bipolar disorder to control psychotic symptoms such as hallucinations, delusions, and mania symptoms. These symptoms may occur during acute mania or severe depression. Some also treat bipolar depression, and several have demonstrated long-term value in preventing future episodes of mania or depression. Antipsychotic drugs help regulate the functioning of brain that controls thinking, mood, and perception. It is not clear exactly how these drugs work, but they usually improve manic episodes quickly. The newer antipsychotics usually act quickly and can help you avoid the reckless and impulsive behaviors associated with mania. More normal thinking often is restored within a few weeks. Antipsychotics used to treat bipolar disorder include aripiprazole, clozapine, olanzapine, risperidone, and others. Side effects of antipsychotic drugs. Certain antipsychotic drugs cause significant weight gain and high cholesterol levels, and they may increase the risk of diabetes. Common side effects of antipsychotic medications include blurred vision, dry mouth, drowsiness, muscle spasms or tremor, weight gain. Electroconvulsive therapy. Indications: major depressive episodes that have not responded to antidepressant medications or mood stabilizers. Major depressive episodes with high risk for immediate suicide. Major depressive episodes in patients with contraindications to use an antidepressant medication. Major depressive episodes in patients who have responded well to ECT in the past. Untoward effects and contraindications. Transient memory disturbances, increases in severity over the course of EST and then gradually resolves over several weeks. Complications of associated anesthesia and induced paralysis. Transiently increased intracranial pressure. Therefore, the presence of space-occupying intracranial lesions requires extensive caution. What is lithium carbonate? Lithium carbonate is used to treat the prevent episodes of mania in people with bipolar disorder. Lithium is in a class of medications called anti-manic agents, which work by decreasing abnormal activity in the brain. Indications: bipolar and schizoaffective disorders. First-line medication for treatment and prophylaxis of mood episodes. Adjunctive treatment of major depressive disorder may augment responsiveness to antidepressant medications in some patients. Untoward effects. Dose-related. Dermatological problems. Weight gain. Cardiac conduction. Hypothyroidism. Leukocytosis. Polyuria. Teratogenicity. And nephrotoxic side effects. Thank you for your attention.